Hi, my name is Jess, and I'm the Director of Intensive Therapy Services here at Napa Center. We're going to talk a little bit today about the NeuroSuit. Such a great therapeutic tool that we've been using here for many, many years. The one thing I want to say right off the bat is that it is a therapeutic tool, not magic. However, we really like to impart the knowledge to our parents that it can be very beneficial for increasing the overall benefits of the therapeutic activities to the wearer. So really thinking of the questions that we get asked the most. Number one question, what is it? What does it do? So in the simplest terms, it does three things. It loads, it compresses, and it aligns. I'll explain a little bit about what I mean. It loads, number one, we can add up to 40 pounds of pressure to the body using the NeuroSuit. Of course, for our smaller bodies, we don't add that much pressure, but we want to do that in order to really activate the anti-gravity muscles of the system, namely the muscles that get you up off of the ground to walk, stand, run, crawl, jump, etc., etc. That's the first thing that it does. Number two, loads and compresses. So you can think of the NeuroSuit as a girdle of support, a compression garment. It's really important to promote good body awareness to our systems, because if you don't know where your body is in relationship to the world, to other people, to other objects, you're never going to be able to move it very efficiently. So very, very important, the compression aspect of the NeuroSuit. Number three, it aligns. This is the one that's more intuitive to our families and our parents when they look at the suit. So if you can take a look at those little black bungees that you'll see in a moment, those really help to activate the underlying musculature and help promote better posture and alignment. If your body is not in the right place to begin with, doesn't matter if you can turn on that muscle because it's not going to do the right thing. So loads, compresses, and aligns. Those are the main three things that it does. Now, who is the NeuroSuit really, really good for? Parents ask this all the time. Is it appropriate for my kiddo? And I will say, if you have a kiddo who you're concerned about general posture and alignment, ding, 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 that's a win. NeuroSuit would be great for that kid. Number two, general strength impairments, ding, ding, ding. Really, really good again for activating muscles of the bum, the lower extremities, the back. And number three, if you just really want to add an extra challenge and really mix up the challenge of your general therapeutic activities, I think the NeuroSuit can be a really, really awesome addition to your therapeutic program.
Dynamic movement intervention, it's also called DMI, is a therapy technique used by both physical and occupational therapists. In DMI, we use exercises which provoke a desired response for the child. So we're trying to get them out of their atypical movement patterns and try to help them achieve normal movement patterns that can then achieve functional goals such as sitting, crawling, standing, walking, and everything in between. We really love DMI because there's a network of therapists that we can collaborate with. It's based on current research, and it enables us to utilize all our tools in our tool belt, including electrical stimulation, whole body vibration, Theratogs, just to name a few, in order to get the best results from our children. It's actually so dynamic that it's difficult to explain with words. Why don't we go inside and take a look? This is an example of practicing a standing exercise with less support, which helps him to achieve the skill.
My name is Jess. I'm the Director of Intensive Therapy Services at Napa Center. And today we're going to talk about the SpiderCage. We're going to talk about what it is, what it's good for, and who's appropriate to use it. Now, the SpiderCage is part of what we call the Universal Exercise Unit, which is a tool that we use for both stretching and strengthening. Now, what is the SpiderCage? The SpiderCage is a tool that we use to help unweight or unload the body. How do we do that? By using a metal frame, using a leather harness that we use to unweight and support the individual, and then utilizing a series of supports, or bungees as we call them, to help do the unloading. Now, why is this important? Some of our patient population actually do better if we help to assist them by unweighting them. So if you think about what your body does in the pool, for example, it unweights you so that you're not holding up 100% of your body, and you naturally feel lighter. You feel like you can push up stronger and you're more upright. So who is the SpiderCage good for? Any patient that we think would do well with that unloading assist, any patient that we think might be posturally insecure or might feel unsafe or unsteady on their feet, on their knees in sitting position, this might be a great tool to use to give them a little better support. And number three, potentially any body that you're working with that's a little bit bigger, that you wouldn't otherwise be able to do certain activities safely because they are of a certain size. This is also a great tool to use to allow for more optimal upright positioning while still keeping them safe and decreasing the risk of fall or injury to yourself or the user. Here, we're gonna use Miss Anaya as an example. Now, Miss Kimberly and Anaya are working on getting those glutes activated so Anaya can be a bit stronger in more upright standing and kneeling positions. Now, the bungees here are helping to unweight Anaya's body, so she's still having to activate the glutes, but she's more successfully able to get all the way up into a more upright position. The higher we put the bungees, the more assist, the more help we're giving the individual. The lower we put the bungees, then the more independent the user is being in the system.
Well, it's no secret that we love the vibration plate here at Napa Center. More specifically, we use the Galileo, which offers a side-to-side alternating motion that most closely mimics walking. We love the Galileo plate for 3 reasons. Number 1, it's fun across the age ranges. Even mom and dad like to get in on the action. Number 2, the Galileo plate adds a bigger bang for your buck with all the exercises adding a strengthening component, increasing muscle activity, strength, and decreasing spasticity. And our third favorite thing about the Galileo is that you can decrease the frequency in order to build range of motion with a gentle stretch.
VitalStim is a non-invasive therapy tool that we use alongside traditional feeding and swallowing therapy methods. It takes electrodes and it provides mild electrical impulses to the muscles for feeding and swallowing, like our throat and our cheeks. It delivers electrical impulses to either the throat or the cheeks in order to stimulate the nerves and muscles for feeding and swallowing to strengthen and increase sensory awareness. VitalStim is used on individuals with dysphagia, which is difficulty with swallowing related to the aspects of the mouth, tongue, or throat muscles. It's not used for individuals who have oral defensiveness or anxiousness around eating and swallowing.